It's a Northwest Lifestyle Weekend on KOMO News. IRG's Health Talk continues.
Next up, we have Dr. Stephen Counter, a general surgeon for the Polyclinic. We're talking about hernias. And, just the word hernia doesn't connote a really good feeling, does it?
Are you cringing a little bit?
A little cringe.
Yeah, it's a topic that we haven't talked about yet, but it's a health topic that a lot of people are going to experience, particularly for some reason. Men seem to have a lot of these inguinal hernias, and Dr. Counter is going to address that with us and educate all of us.
Interesting to hear what he has to say. Dr. Stephen Counter and Shannon O'Kelly on IRG Physical and Hand Therapy's Health Talk.
Dr. Counter, welcome. Welcome to Health Talk. How are you doing today?
I'm well, thanks.
Well, I'm glad you're here because we're going to talk about hernias. But before we get into hernias, which, by the way, is a topic that we haven't touched on this show, so it's new for us, and you're going to give us all the information on it. But tell us about your practice and kind of how your day works and your area of interest and how you got interested as a general surgeon, maybe.
Great, thanks. So I'm a general surgeon at the Polyclinic, and I like to tell my friends that I'm an ambulatory outpatient surgeon.
There you go.
And that confuses them. But what it means is I do a lot of outpatient surgery where patients are going home within an hour of waking up from anesthetic. We do most of our surgery at First Hill Surgery Center, and that's about 80% of my practice. About 20% of my practice then is the more classic inpatient hospital work where people may stay several days in the hospital.
Tell me about your interest in general surgery and your training.
I trained here in Seattle at Swedish Hospital. I've been at the Polyclinic for now almost 20 years. I developed my interest in hernia surgery really when laparoscopy became much more popular into the late 90s. That's where I trained in that era, and so I've been able to incorporate that in my practice.
Okay, so let's talk about hernias. Anatomically, tell us what's going on there.
Yeah, so hernias, most people think of hernias, I think of groin hernias or inguinal hernias, most commonly seen in males. But in the United States, there were somewhere around 500,000 hernias repaired last year. So it's not just in the inguinal region. There are belly button hernias. Everyone who has an outie belly button has a hernia. We have hernias in incisions, and of course, people may have had a colostomy or an ileostomy. That's a different type of hernia, but hernias are very, very common.
So the word hernia, maybe you can describe it. What does it actually mean? Is it just a bulge of tissue? I mean, that's fairly limited, but tell us what hernia means.
I think that's accurate. You know, a hernia is a hole in your abdominal wall through which something is bulging. And if you go on the internet and you see a lot of books, you'll always see a loop of bowel in there. But in fact, that's not really what we see. We more often see fatty hernias, small amounts of tissue, and of course, the bigger hernias can involve organs or even a bowel, but that's not usually what we see in our ambulatory practice. It's mostly a bulge that people notice, maybe a little bit of discomfort. Oftentimes people are concerned about cancer, tumors, and they see their primary care doctor, and our primary care docs are really very in tune to hernias, and so I'll fix over 200 hernias in a year. It's that common in my practice.
So tell us about the cause. I mean, is this one of those things you describe it as like a rupture in your abdominal wall? I mean, you're lifting, twisting, turning. Is it a traumatic event? Is it over time? Do you have inherent weakness there? What's going on there?
Well, so the Hollywood version, of course, is always the old guy out chopping wood,
right? And that's me, by the way.
Yeah, right. So, but it's all ages. So we have pediatric hernias that are really the congenital weakness that most boys, but also little girls, can have in their inguinal region. Then there's the incisional hernias that we see related to previous surgeries. Far and away, the majority, though, are still inguinal hernias. I see great athletes. I see people between the ages of 30 and 60, I think, as most of my patients. Most of them are active, but not always is their hernia associated with an activity.
Back with Dr. Stephen Counter and Shannon O'Kelly right after this time out on KOMO.
Dr. Counter, again, thank you for joining us here on Health Talk, and thank you for talking about hernias for the first time. You did a great job setting it up, anatomically describing it, but I guess our listeners want to know, how do we finally end up with you? What's that sequence or that continuum of care, if you will?
Yeah, most of my patients come through our primary care doctors. They'll have gone in with a complaint or a concern about a bulge, usually in the groin. Their primary care doctor will say, yeah, I think it's a hernia, go see Dr. Counter. And when I see them, they are ambulatory patients. They're well, they come from work, and we do, the standard exam, turn your head and cough. That's a very common scenario, and one or both sides, about 30% of patients will will actually have hernias on both sides.
So let me ask you a question real quick, because I mean, the old, I have a lot of guys ask me this question, the old turn your head and cough test, right? Let's talk about that. So what you're doing is you're palpating up in that area where there's normal weakness. If the weakness is going to occur, it's going to be there. And when you cough, do you feel a little bulge there? Is that what you're looking for?
Yeah, visually see a bulge and also feel a bulge or a significant impulse. Sometimes when they cough, it will recreate their pain or their discomfort that initially concerned them. And that's diagnostically about 95% accurate. So we don't need a lot of other tests. So usually you can just see the hernia surgeon and he'll say, yeah, you got a hernia. And oh, by the way, you have one on the other side too.
Wow. Okay. Is that common to have them on both sides?
Yeah, about 30% of patients will, in fact, get one on the other side at some point, not always at their first presentation. So maybe 5 or 10 years later, perhaps.
So someone comes in and you're, as a surgeon, you're going to say, well, yep, this needs to be repaired. I guess the question, do they all need to be repaired, or are there some that you let go, or how do you judge that? Yeah,
a lot of literature now on watchful waiting of hernias that are basically asymptomatic. That is to say, yeah, there's a small bulge there, but it doesn't affect their life or their job. And we'll watch. I'll be honest, though, that most guys come in with a bulge. They're worried about it, and usually within 3 to 6 months, we're repairing their hernias. They do get symptomatic. They're concerned about it. Maybe they're traveling. Their job requires them to have it fixed. So those are the common scenarios for going ahead and fixing the hernias.
And tell us about the repair, the actual operation.
My preference for most patients that are healthy and active is a laparoscopic repair, where we implant a piece of mesh, use small incisions under general anesthesia, again in an outpatient setting, where within an hour of surgery they're on their way home recovering. Usually within a week they're back to work, and within 2 to 3 weeks can be even back to playing golf or tennis or pretty normal activity, assuming that they're pain-free and recovered uneventfully.
So that's pretty amazing. This is one of these minimally invasive surgeries we're talking about through the scope, and the recovery's pretty quick. I imagine there's just biologics. It takes time to some scarring and some healing to take place.
Well, everyone has an inflammatory response, and that's a time-related phenomenon. You can't make that go faster. But by making the small incisions, they're on a lot less pain medicine. They're back to work sooner. They're driving sooner. Many of my patients just take Tylenol.
As we wrap this up, it's an easy procedure for the standpoint of, in today's world, minimally invasive. The recovery time is pretty quick, and you said about 6 weeks you're back to most activity?
Even sooner than that for the majority of patients. It's really quite amazing to have guys out telling you about their golf game 2 weeks after their hernia surgery.
That's great. Again, thank you for your time. Great information. That's why I love Health Talk, is I always learn something. I learned a ton today from you.
My pleasure.
Look at the topic I don't think any of us love talking about, but hernias, as you mentioned, Shannon, we had not discussed before, and we try to address just about everything on this show, and so we're happy Dr. Counter gave us a little bit more insight into that.